I'm Armand Hendy, Professor Emeritus, Emory University School of Medicine, Department of Gynecology and Obstetrics. I was born in Decatur, Georgia, grew up there, attended college at Davidson College in North Carolina, and came down to Emory in 1943 to complete my last year of pre-medical requirements and entered medical school at Emory in 1944. I graduated in 1948, joined the regular Army, where they allowed me to stay at Grady for 2 years during my internship and assistant residency in obstetrics and gynecology. And then I went on, they called me up to serve in the Medical Corps of the United States Army. I was sent to Germany, where I stayed for 3 years, and in the Army of Occupation. I returned to Grady Hospital to complete my residency training and completed it in January of 1956. While I was at Davidson, the war started, and I joined the Enlisted Reserve Corps, which allowed me to complete that year. It was 1942, 43, and because I was a pre-medical student. And at the end of that year, I came back to Decatur with a transcript of my grades from Davidson College in one hand and orders to report to active duty in the Army in the other hand. I went out to Emory. I was advised to go out and talk to the dean at Emory. And that was Dr. Oppenheimer, who had his offices in the Emory Clinic, in the Emory Hospital. And he sent me around to several other members of the faculty and then sent me home. I had a lot of desire, but very little hope that I would be accepted to medical school at that time. But a week later, I got a letter. We are happy to tell you that you've been accepted to the class beginning in September of 1944 in the School of Medicine, based on satisfactory completion of your pre-medical requirements at Emory starting on the 1st of July, 1943. Therefore, I transferred and stayed at Emory from that day until 1996, at which time I retired. I had returned to Emory, to Grady, for my residency training program, and I had 2 years to complete that residency training. And during that, toward the end of the year, Dr. John Cross, who had acted chairman of the department at that time, approached me and told me that about the gift that Mr. Woodruff had made to Emory and the plans by the Board of Trustees to build an Emory clinic. He said that he was going to move his practice and be a member of the faculty of the Emory Clinic, and asked if I would consider joining him. I didn't know anything about the Emory Clinic except what I've just told you. The idea of being associated with Emory was very appealing. the idea of a residency training program, which I very much enjoyed being associated with, was very appealing. Most of all, I was ready to get on with my life and my career and my specialty. I knew that the Emory Clinic would be a referral clinic where we would be treating the unusual and difficult and complicated cases. That was very appealing. The income factor was not great in my mind, but I was considering how this would work, and I found out. It was a good decision. Emory Clinic was formed at a time the war was over. Medicine was going ahead by leaps and bounds. Emory University School of Medicine needed a full-time faculty. The idea of Emory entering the practice of medicine was going to be difficult to sell to the doctors in the state of Georgia, and particularly in the Atlanta area.
Why?
These doctors had practiced during the Depression. They had been in the service. They naturally did not want competition to be brought into the Atlanta area by Emory University. When Dr. Scarborough, who had a good insight, an uncanny insight into human nature, realized that that might be a hurdle for the establishment of the Emory Clinic, he made it clear to the doctors of the Medical Association of Georgia and the Fulton County Medical Association that the staff of the Emory Clinic would not be trying to compete from a financial standpoint, that they would see patients that were referred to them. They would, the top salary of the top people in the Emory Clinic would not exceed $25,000 a year. Recruited people would be started at a much lower income. In fact, my income when I started at the Emory Clinic was $5,000 a year. And that was one of the concerns at that time. And, but that changed, and the benefits and the income from working at Emory was certainly satisfactory. As I mentioned, the idea of being associated with a teaching program, I didn't know much about academia at all, but I did love the idea of being associated with medical students and residents was very appealing. And as I mentioned, the referral type practice of interesting patients would be, I think, very satisfying. The name that comes to mind immediately was John Cross. John Cross was a very special person to me. He asked me to join him in practice at Emory when I was his senior resident, and there were things about him that I truly admired and consider him as a mentor. John Cross was a Southern gentleman. He was a scholar. He truly loved being an obstetrician and a gynecologist. He had tremendous respect for the reproductive function of the female. To him, the specialty of obstetrics and gynecology was the guardian of female health care. He felt it was a privilege when a person asked him to be their doctor. He operated with that same attitude. He was fast, but he had a reverence for the pelvic organs of the reproductive system, and he treated them that way. I guess John Cross taught me more about the art of practicing medicine than the science, although he was a good source for that too. His patients, or my patients, are special people. They've come to me with a problem, and I wanted to know the person beyond just that problem alone. I wanted that person to have confidence in my ability. And I think that that takes some time to get to know the person and to practice in a compassionate and thoughtful way. There are many things that make up the art of practicing medicine, but being in too big a hurry and being crowded with being overworked will take away a lot of that. I do, absolutely. And unfortunately. But the world is moving very fast. Also at that time, remember, we didn't have the internet, and your patients came to you frightened and without much knowledge of their anatomy or their problem or what could be done about it. And the art of medicine was much easier at that time when you could explain what was going on and have their understanding and trust. And I think that's awfully important in getting well. The number of patients and the demand on your time is enormous. The fact that our system of compensation makes it very important that you see large numbers of patients in order to generate the income that you need to run your business and to find satisfaction for your own personal needs. And you can't do that and give the patient the time that we were able to give at that time. I don't know the answer, but certainly recent changes have not provided an answer. There would be residents that would come through. They would be, there were a number of them over the years, people that I grew to know and admired and felt like I was helping them come along. They said nice things. Some of them, I hope they met them. And when I retired, I got some nice letters, so perhaps they were my mentees. Yes, I knew Dr. Scarborough. When I first went out to Emory, I didn't know him well at all. But over the next few years, I came to know Dr. Scarborough, and I admired him. He was certainly the right man at the right time for the development of an Emory clinic. Dr. Scarborough had been brought to Emory, as I'm sure you know, by Mr. Woodruff, to head up the Winship Clinic, which was his gift to Emory in tribute to his mother. I think the fact that it was to his mother that he wanted it very much to be a successful gift and development. Well, Dr. Scarborough became Mr. Woodruff's friend, more than just director of the Winship Clinic. Mr. Woodruff and Dr. Scarborough were close friends, and he traveled with him and he advised him, besides being his doctor. And Elliott Scarborough had a dream. He knew that Emory University School of Medicine needed a full-time faculty. He knew that changes were occurring in medicine so rapidly that we couldn't depend on the volunteer faculty, but people who were interested in teaching, well-informed, and the kind of staff that a good medical school, a top-flight medical school, must have. I think the idea of the Emory Clinic being sort of a three-legged stool is that he wanted research, teaching, and patient care, and that was Dr. Scarborough's idea. Mr. Woodruff liked that idea. The Board of Trustees liked that idea, and the rest is history. That's a good question. He was the classic, just good old country boy. He was very bright. He had an uncanny insight into human nature. And when he faced the issues that might in any way block his dream, and his plan, then he would work it out politically, socially, scholarly. He could handle. He was the right man at that time to start the Emory Clinic. He would go before the Fulton County Medical Society with his hat in his hand. And just, we're not going to interfere with your practice one bit. We are there to serve you and to make this a better medical school, a school that you and the community will be proud of, and these kind of things. He did not want to let it bog down on a political or an infighting way. My favorite story with Elliot Scarborough, I had just come out there. We didn't have an Emory Clinic building. My office was in the hospital. They were building the clinic. And I got a call one day to see Dr. Scarborough on 4 East at Emory Hospital. I was probably 33 or 34 years old at that time. Not sure when it was. But Dr. Cross was chief of the section, and I was there new. And I got up to 4 East, and he said, I want you to meet Mr. Woodruff. Well, I had never met Mr. Woodruff, and I shook his hand, and he said, the reason I've asked you to come up here, he said, Mr. Woodruff's niece, the daughter of George Woodruff, has been admitted to the hospital, and she has a pelvic tumor, and I would like for you to take care of her. It was a terrific vote of confidence that I appreciated more than you can imagine at that stage. I did take care of her. Everything went well, and she was a patient of mine for years, and her mother, George Woodruff's wife, and her sister, Jane Woodruff. All of them have been patients that I have been privileged to take care of. But I always appreciated Elliot Scarborough doing that for me when I was brand new at the Emory Clinic. It was a close group. The best thing about it is any patient that you had, if there was any question that you needed any help from internal medicine, from neurology, from hematology, from general surgery, these doctors were available. They were people that I knew well. I knew everything about them. I trusted them. And it was a group practice in that sense that gave the patient the greatest benefit that I can imagine, to have that kind of. We also had the very best of equipment. There was never any doubt. If anything we needed, it was provided as far as diagnostic equipment is concerned. We had a residency training program and had our residents there to assist us and to assist in the care of the patient with us. It was a pleasure. Each department had 1 or 2 people they needed to recruit, build up the section. That was the main thing, is to bring in doctors that would later become partners in the clinic and would work in that section under the direction of the chairman of their department. And I think recruitment of the best available, people who wanted that for their career, a mixture of practicing and academia. Yes, in many ways. Emory had the clinical years at Emory at the School of Medicine depended a great deal on the volunteer work of the faculty, the volunteer faculty from the practitioners in the city. These people were getting busier and busier, and their private practice came first. And many times they were unable to meet their responsibilities at Grady. And the medicine was getting more complex, and the technology available was more complex, and the volunteer faculty did a wonderful job, but it was inadequate for the pace that medicine was taking on at that time. But the formation of a clinic was to be a referral center. At that time, there were no other large clinics, no other clinics of this type except at Duke. And now the University of Alabama was near the same time, but I think at the earliest, at the beginning, it was also just beginning. But they needed the doctors in the South area in the state. We've had patients referred from all over North Carolina, South Carolina, Florida, Alabama, Georgia, and indeed from some foreign countries. And that was necessary because of the need for quality medicine and for the equipment that was available at a medical center. Would afford better care for the area. Mayo did. Mayo, I don't know, we people went up there to study. They have developed the best system of taking care of the referring doctor. That's where Emory has failed. Now, many of them do, but as a group, not like Mayo. The Mayo, if you send a patient, if I send a patient to Mayo Clinic in Jacksonville, or it used to be just in Rochester, that patient would come back thinking that I was the best doctor in the world. That's salesmanship. And that I would be anxious to send them another one. It worked.
Fascinating.
It's fascinating. But and Emory never could do that. You know, when a person has referred you a doctor, referred you a patient, and you see where it hadn't been managed the way you thought it should, you should never let that patient feel that way about her doctor. You never. And yet some people just do it instinctively. You know, they just can't help. They think they're so smart that they're going to just raise an eyebrow. Huh. You know. Oh boy. You mean oh, wow, okay. Let's go. All right. That's a no-no. And yet, I think, but that's another subject entirely. All right, the Emory Clinic, at that time there were no other large clinics, and in the Southeast it was a referral center with the latest in equipment and in diagnostic and treating skills. It was they would receive patients from the referring doctor, do what was necessary as far as treatment or diagnosis, and refer that patient back to the doctor to take care of. This was the idea of the Emory Clinic, and it was very important at that time. The mode of transportation was available. That would be an important issue. The facilities for staying in Atlanta, the hotels, motel, boarding rooms for family to stay while their family member is involved in treatment. And the Winship Clinic was part of the Emory Clinic, and a referral cancer clinic. This being very important for patients from outside in the southeastern area. Winship was a nucleus for the Emory Clinic, and it remained a section of the Emory Clinic at that time. I think Duke and Johns Hopkins were more models than Mayo at that time. We would talk frequently about our association with the other clinics. Members of our faculty would attend meetings and have good interchange with information and dialogue with the members of the other Hopkins Clinic and Duke Clinic and other medical centers, medical schools. We would get feedback from those who had referred patients to us, and many of them would refer their patients over and over, the ones that they needed some assistance with. I think we were certainly felt that we were a good clinic, and certainly and in many ways the best in our area. The early relationship there was always good. Arthur Richardson was the dean of the medical school, and he recognized the members of the Emory Clinic as being his full-time faculty, and he had other faculty that were full-time at Grady Hospital. I think the interchange, the chairman of each department would appoint a deputy chief of the section out at Emory if their office was at Grady, and they would outline the program for the members of the clinic where they could help in the chairman's plan and his department's function. And it was a very good relationship, I think. I always felt that we were helpful to the Department of Obstetrics and Gynecology, in that residents and students would rotate with us, and we would go down to Grady and hold conferences and teaching experience. And so it was the interchange between the faculty and the university, the medical school was excellent. In the college, the idea of becoming a tenured faculty was a mighty goal.
In the college?
In the college.
Okay.
I think many faculty in the college devoted most of their time and their talents towards doing things toward promotion. And they would publish, and they would teach, and they would do all of the things related toward being promoted and reaching tenure. In the medical school, there was not that desire or that motivation to achieve promotion. We were focused on doctoring, and with less focus on the academic ladder. When promotions were made in the medical school, the chairman would recommend a promotion from assistant professor to associate professor and on up the ladder, based on conferences and publications and those other things. It became, I think, the college felt that the medical school had not done all of the requirements that they thought should be there for promotion to tenure. That's my opinion. I don't know. But in fact, what the medical school did was develop a clinical tract, which was not a tenured promotion. And they could, you could achieve elevation in your academic rank by without a tenure being it. You could be an assistant professor, a clinical assistant professor, or on the clinical track. And just as the volunteer faculty in town could be clinical this or that, the ones in the medical school would be assistant professor clinical track and associate and so forth. So that took away any feeling of competition between the college and the medical school. And yet there were many of us who did go up the academic rank with tenure. Certainly all the chairmen and many of the others. My assistant, her name was Tommy Turner. Tommy Turner was a blessing. Patients would come to me and come up to Emory from out of town, and they would be frightened. And the whole family would be there, and Tommy would be the first person they saw after they got to my office. And invariably, she would put them at ease. Tommy would bring them into my office and introduce them to me, and it would be sometimes a patient with her frightened whole family would be there. And before they left, they knew Tommy about as well as they knew me. And many times patients would call to ask questions and they'd want to speak to Tommy. And I don't know, she was very valuable to me. Then on the obstetrical service, there was my scrub nurse, Linda Southern. Goodness knows, I depended on Linda Southern for so many things, but she would make things happen in the operating room that it wouldn't have been near as nice without her. In fact, when I retired, my wife told me that she wanted me to be sure she was not my secretary or my scrub nurse. The overall story, there were successes in the departments that varied, but probably cardiovascular surgery was a great success. The ophthalmology, development of the eye clinic, and the progress made in ophthalmology was a great success. In our department, obstetrics and gynecology, my personal success was with the RH, when we were doing obstetrics, was with the RH factor. And that was when the women were sensitized to the RH factor, and the baby, the second baby, not the first was not involved, but the second baby would develop the condition of erythroblastosis. And for a long time, the only thing we could do for that would be to deliver them prematurely. And then the pediatrician would take them into the neonatal nursery and do an exchange transfusion. And that would be if we could get them past 32 or 33 weeks of a 40-week pregnancy. What I developed in our section of clinic was we found out how to take amniotic fluid and find out just how anemic the baby was at that stage of pregnancy. And if it was so anemic that it couldn't make it to the 32nd week for premature delivery, we would give it a transfusion by giving it blood into the fetal abdomen. We did over 50 of those with good success. Later, the pharmaceutical research developed ROGAM, so now the patients are given ROGAM following any delivery, and that prevents sensitization, and so the problem has been pretty well eradicated. Another accomplishment was reconstructive pelvic surgery. We developed an operation that had been surgery for that massive prolapse problem was often failed, and we developed a procedure that restored anatomy and relieved symptoms and restored function very successfully in reconstructive pelvic surgery. Those were highlights, and I could go on and on with other sections I'm sure that you can find out about, but that's enough for you. One of my favorite stories, there's several, but one of my favorite stories was I had a patient who had lost 2 babies with erythroblastosis. And she had 1 living child, her first. And at about 15 weeks gestation, or 16, we discovered that the baby was severely anemic. And there was no way that that baby could make it to 32 weeks. The transfusion of blood, the amniotic fluid was drawn, the laboratory report gave me that information, blood was prepared and given under fluoroscopy, which was very short. You couldn't over-irradiate to give them danger of radiation. And I gave it a transfusion and repeated it every 2 weeks until 32 weeks. And I'll never forget doing a cesarean section and handing that baby to Sidney Brebot, the pediatrician who took the baby to Eccleston, and asked me if I wanted to come over. I said, no, I'll be waiting in my office. It was dusk, the clinic was empty, and I went in my office. And I remember sitting there and waiting and praying. And my phone rang, and Sid Brebot said, Armand, this baby is going to be fine. Those are the kind of things you never forget. There are a lot of stories, clinical stories that I could tell. I remember we used to have a little dining room. There'd be 10 or 12 of us there eating lunch in the basement of the Emory Clinic. And there was a lot of camaraderie there. And I remember Mrs. Manders, who ran the little kitchen there, bringing me a birthday cake. And I was 36. And I don't know, those are just memories that I think about. All of those doctors are gone now. They were great. They were great guys. I loved being a member of the Emory Clinic. I would like to start this interview with a few stories that I think reflect on the magnitude of the gift, the vision, and of the philanthropy that happened to begin the early days of the Emory Clinic. I'll start back in, it was 1944. I was a freshman medical student. It was early in the year, and the class assembled, and and it was Dr. Elliott Scarborough was speaking to our class. He was a man in his mid-40s. He had little round glasses. He had a short white coat on, and he had a handful of photographs. I remember that day distinctly because he commented that he could tell more about a person by their looks and by their attention and in their eyes. And when he finally got to ask me to stand up, he said, "Well, I never would have recognized you by this photograph." I had no idea what that meant. All it did was add to my already apprehension over what lay ahead in medical school. We had already heard all of the stories about how hard it is to finally graduate and make the grade. But anyhow, time went on. But that was my introduction to Elliott Scarborough. I had no idea why that man was here. I learned soon that he was the director of the Winship Clinic, that Mr. Woodruff had given a significant gift to Emory to form the Winship Clinic in honor of his mother. He had recruited Dr. Scarborough to be the director. He was a Southerner. He was from Alabama. He had attended Harvard Medical School. He had trained at Memorial Hospital in New York. He had been exposed to what a medical center should be. He had come to Emory. He knew it was a fine university. It had a good medical school, but it was not a medical center. I had no idea of the vision that man had at that time. But anyhow, we'll go on from 1944. And I was my junior year of medical school. My mother called me and told me we were going to have to borrow some money to complete medical school. I was a Depression child. My father had been killed in an automobile wreck and left no insurance. We had done pretty well due to the gratitude of Emory. They had found me jobs. They had gave me a small scholarship. And at that time, I was working as an student extern at old Piedmont Hospital on Capitol Avenue. The news really wasn't a surprise, so I went to the business office and I talked to Mr. Lewis Harris. He pulled my ledger. He said, "You're doing fine." He took a pencil and drew a line. He said, "Pay us back when you get through." I was grateful. I got through. I joined the Army, and I paid them back. It didn't take long, and I was glad to do this. And I felt good about Emory and what they had done for me at that time. So when the day came, and I was asked I was a senior resident, and Dr. John Cross asked me to join him at Emory. He had been asked to head up the division of obstetrics and gynecology in the Emory Clinic. I didn't even know what the Emory Clinic was at that time. He told me that Mr. Woodruff had given a large gift to Emory, and that the Board of Trustees had elected to build an Emory Clinic where all the members would be full-time faculty. They would be given all of the benefits of the Emory Clinic with every imaginable facility for the practice of medicine. They would have the advantage of the Emory Hospital to use with all of its facilities. The majority of my time would be used in the clinical practice of obstetrics and gynecology. And also I would be involved in a full-time faculty involved in teaching and clinical research. My focus until that time had been simply to get full training and to be as good an obstetrician and gynecologist as I could be, and to go in private practice. I never considered academic career. But I was grateful to Emory for so much that it had done for me. I looked forward to being a member of the Emory Clinic. We moved our offices. No, we didn't move our office. Our office was then in Emory Hospital while they were constructing Building A of the Emory Clinic. Early on, while I was in that office, our practice of obstetrics and gynecology was growing. I received a call to go to 4 East that Dr. Scarborough would like to see me. I had no idea what he wanted. I went up there. He introduced me to a person I'd never seen. It was Mr. Robert Woodruff. And he told me that Mr. Woodruff's niece had been admitted to the hospital, and he would like for me to take care of her. I wasn't surprised. I did take care of her. But in hindsight, I realized what a vote of confidence that was for me. And I always loved the man for having given me that responsibility. Another story that I remember so vividly about the early days of the clinic was we would have a end of the year meeting. Dr. Scarborough would preside, and he would have with him at that meeting the business manager, and he had prepared charts and slides showing what the Emory Clinic had done that year. The hours devoted to teaching, I don't know how in the world he calculated that, but he did. The amount of money that had been collected, the distribution of those funds, the distribution to the drawing accounts of the members of the Emory Clinic, the distribution to the medical school, the distribution to the departments to be held for teaching and research. We called it the T&R Fund. And then he told us he would give that information to Mr. Woodruff. What he was doing, Mr. Woodruff was a businessman. He was showing Mr. Woodruff his investment and what it was producing. And it pleased Mr. Woodruff. And I think that's how he trusted Elliott Scarborough. He was his friend, his confidant. And Elliott's vision was promoted with this information going on to Mr. Woodruff. That was a routine, the year-end clinic, where all the numbers would be there. The billing, the collection, the distribution. And he'd show that to Mr. Woodruff and look here what your investment's doing. But not only was the investment, but it was going on. We were having faculty, and we were adding. Dr. Cross was given the green light to hire more faculty. This was the big thing in what was happening. These were trained, skilled people at Grady Hospital to teach and to train. We were down there as residents without that. And they had a few, but not near enough. He was a keen politician. He had to sell this idea to the Medical Association of Georgia. Now, Medical Association of Georgia was saying, wait a minute, this is the corporate practice of medicine. You're going to take our patients. That's hard to sell. He went to him with his hat in his hand. Look here, we're missionaries, man. We're just there to train students and train doctors. We're not going to take any patients except by referral. All sorts of lies. But that was necessary. He was a politician, and he was a good one. And of course, the corporate practice of medicine is everywhere. That's all we got, practically. But it was a hard sell then. The jump start for that came with the gift from Mr. Woodruff and the vision of Elliott Scarborough to make an Emory Clinic. From that, we had faculty. And Dr. Cross, in obstetrics and gynecology, was given the green light to hire more faculty. Trained, highly successful physicians that would be full-time at Grady Hospital, focused on teaching, training a resident staff, and research. It was a three-legged stool, and those were the important features. As the benefits of all of this increased, the center became larger and more successful, and became a recognized medical center through publications and conferences, postgraduate conferences, and more and more time was spent, and research became an important feature of the Emory Medical Center. Recently, I was asked to go to the development office. This is always scary because, but it was a pleasant experience. I had an opportunity to see the medical school and be on the campus and see the amazing things that have happened even since my retirement. And I made a gift to the scholarship fund for the medical students. And as I drove off, I looked at my window on the fourth floor corner of the Emory Clinic, and I suddenly realized that all the things that came to me all those years was simply because I was part of the Emory Clinic. And I also realized how hard I'd tried, but I realized there was no way I could pay him back. I remember one of the directors of the clinic early on saying we are a three-legged stool. And it was teaching, research, and patient care. I was just going to practice, do the best I could, make a living, buy a car. But it turned out differently, entirely differently. I did only clinical research. I did no basic research. My clinical research consisted of accumulating data and on procedures. In other words, I developed a real interest in reconstructive pelvic surgery. I had a failure in an operation that involved reconstructive pelvic surgery. I went into great detail in studying the anatomy of pelvic support. I've developed an operation that was successful in something that had failed for years, in total prolapse of the pelvic organs. This operation was successful. I spoke about this operation at conferences. I taught this operation to residents. I published this operation. A company came to Emory Hospital and did a video of that operation with comments following it. That's the kind of information and clinical research that I enjoy doing. Then we reported the number of cases done, the complication rate, and the success rate. Another example of being at the Emory Clinic. A bit player, but I enjoyed it. Yes, as far as I remember or know about it, this was going on before or during my early days in the clinic, and what I understand is that when it was announced that Emory was going to have a clinic and would be practicing medicine there, the Medical Association of Georgia and the Fulton County Medical Association were concerned that Emory would be taking their patients, and we were just after the Great Depression, and every doctor valued each patient as being their patient. Dr. Scarborough was very astute in the way he managed that problem. He went to the Medical Association of Georgia to reassure them that Emory would not take away their patients. He reassured them that the primary mission of the Emory Clinic was to establish a faculty and to train students and residents and to become a medical center from that standpoint. He also told them that the maximum income would be limited to, I think the maximum income that he told them was $25,000 a year as top pay. And then he also told them too that every effort would be made to send back the referred patient to the doctor, and that no patients would be seen on most services except by referral. I still enjoy playing golf. I enjoy playing bridge, and we love to travel. We have a home in Highlands, North Carolina, where a lot of good summers are spent, cool weather. And we have a trip planned in April to go back to Western Europe and do a river cruise up the Rhine River. And if the world situation is safe at that time, I'm looking forward to it. Otherwise, I'll hunker down at Highlands, North Carolina. They were perfectly reliable, wonderful volunteer faculty that would help us with teaching and training and taking care of complicated or unusual cases when we were residents before the full-time faculty was available. The money that went from the clinic into the hospital, into the medical school, gave the dean budget. I joined the regular Army in 1948 when I graduated, and the Army let me stay at Grady Hospital for 2 years for an internship and a first year of specialty training in OB and GYN. And then they sent me to Germany. And with only 1 year of training, I was given a specialty rating, and so was chief of OB and GYN at an Army hospital in Bremerhaven, Germany, where I stayed for 3 years. And I loved it. I had a modest confidence developed by all of the training I'd had at Grady Hospital those 15 months, 3 months as an intern and 12 months of specialty training. And I had a chance to read and attend conferences and see how OB and GYN was done. They had cleaned up, but they had not started rebuilding at that time. The Marshall Plan was in effect, and that in itself was just an absolutely amazing accomplishment. my service there was after the war, and my patients were the nurses and wax and waves and dependents in military in the occupational days. I am amazed at how it has preserved its individuality. It is a really nice town. We always thought of Decatur as a home of schools and churches, you know, and they had it was a great little community to grow up in, and I think it is now a wonderful community.